Well, happy, beautiful, amazing day. Dr. Bob Rakowski here, and I am excited to introduce you to an amazing individual, Dr. Cliff Tao, chiropractor and board certified chiropractic radiologist, which I got to tell you, I know a lot of people that tried to take that path, and I believe it's about as challenging a path as you can do. People that were brilliant time and time again trying to get through that DAC bar, you've done it. So obviously, you're a brilliant guy. We're going to talk about x-rays and the value, and probably most of all, the value of someone who understands structure, function, biomechanics. You might think radiologists all do that, but I got to tell you what, their specialty is film. This guy is a specialty in structure, function, radiology, and how it all integrates. Dr. Cliff, thrilled to be talking to you. How are you on this epic day?
I'm wonderful, wonderful. Thank you, Bob. Thanks for having me.
I'm honored. And by the way, a family man has his son Liam. They enjoy time together, so they're together. He's quiet in the background. I'll tell you what, family first, right? That's the first value. You got that going for you. So, how did you take that path of radiology?
Oh, it's a bit of a long story, but I think it started with my dad. So my dad is now retired, but he's a medical radiologist. And I think we kind of have the same kind of mind. We both like to overanalyze things, analyze things at the wazoo. And he's more of an introvert than I am. I'm a tad on the extrovert side, so I still like talking to people, which apparently is a little unusual for radiologists. And it's unusual for us to be on a podcast too. Apparently, there's not too many of us that volunteer to do these things, but I like it. I like meeting new people, being adventurous, exploring new things. And when I got into, or actually even before I got into chiropractic school, I don't know if you remember, Bob, but there were these, in the infancy of the internet, there were these, we what do we call them? E lists or electronic lists. Like, you remember those? Major domos, I think was a name for them. So you get on these email lists and you just get, mounds of data. And I loved them. Like, wow, look at all this data about whatever you wanted. There was like lists on chiropractic, but even within chiropractic, little sectors within chiropractic. And that's how I got interested in radiology, because I didn't know there was chiropractic radiologists, and like, oh, maybe that's something I could do. But I always thought it would be too hard to get in. Like you said earlier, it's not that easy to get in and finish it. And then when I got into chiropractic school, I met the radiologists there, the DAC bars, and they're all really nice. And they invited me to hang out with them. And so I hung out with them, every week. I'd check in with them a couple times a week and kind of look over their shoulder as I looked at different types of x-rays and stuff like that, got to know them. But I still thought it was going to be too hard to get in. I didn't have, stellar grades in chiropractic school, not in college either. Hopefully he's not listening too closely. And but I had the passion and interest in radiology. I loved it. It was just so interesting to me. And so, radiology was easy to me. The other courses, were a little bit harder, but I did okay in them, above average, but not stellar. And so I got into radiology, and it's just been nonstop since then. And it kind of sounds bad because if you know any radiologists, Bob, a lot of us, we it's hard to do both, like radiology and a regular chiropractic practice. I mean, you got to be super, super smart, to do it. I'm not that smart, and I could only do radiology. So you get into it and you kind of get thrown into this big, deep, dark hole. And it is really hard to kind of come out and see patients again. And it's almost like, I was just telling someone about this the other day. It's hard to for me to change. It's like two different languages, right? Talking to patients is one way, and then talking to my fellow chiropractors is another way. Kind of saying the same thing, but the style is different. So, uh, so I really like talking to my fellow colleagues, fellow chiropractors, and trying to figure out, what's going on with this X-ray or MRI or something like that. And I love it. I think it's the best.
Well, I have a funny radiology story. I was at one of the Texas conventions,
Uh-huh.
and they had an X-ray on a view box, and it was very unusual film. And they were walking by, and this is, what's wrong with this patient? And one, okay, you could make a radiology diagnosis, but not necessarily anything else. But I looked at the box and I said, the patient is dead. And they said, that's exactly right. How did you know that? And I said, no gas patterns in the intestine, you know?
Oh,
And
wow.
enough, everybody was looking for everything else. And I just looked and went, well, the patient's dead. That jumped out at me. So that was kind of funny.
Good
But
job, Bob. Yeah.
well, thank you for that. Let's go to the pros and cons though. So way back when film technology was nowhere near as good as it is now, risks with radiation, you wanted to shield the gonads, shield the thyroid, don't over radiate the breast. I still, by the way, believe in that. Don't over radiate the breast. But tell me
Yeah.
about how has the advances made your job easier and it better for the patient?
Oh, the biggest thing I'll say is the internet. I mean, it sounds kind of cliche, but when I started so I was in school in the early or mid to late '90s. Graduated in 2000, and then when I finished radiology in 2003 or 2004, because I did an extra fellowship after. Most chiropractors were on film, right? Analog X-ray, and it was really problematic, getting the films to my office and getting them back in a timely manner. And it made things just real hard operationally. And then when the digital X-ray came, like, whoa, wow, it opened up, other states, other countries even. And so now, that's, I think, really good for patients because, we have people from all over send us something, and our system allows them to submit the X-ray, and with one extra click, they can mark it stat, rush case, and then I get an email right away. If my staff sees it before I do, they'll text me and they'll be like, "Hey, there's a stat on the horizon. Look out for it." And it gets done right away. Maybe a couple hours or a few hours later, but it gets done usually the same day. I'm like, wow, this is amazing. And so patients can know right away that the chiropractor can, maybe even with the patient still there, can start doing, whatever they feel comfortable doing. And I think I think it's been great. So it's been great, for patients, but also great for me too, because it's been a lot easier for me to scale up my practice.
And is there less radiation exposure with digital? And have we gotten better with all of that as well?
Oh, with X-ray, I think it's actually about the same. I know with digital when it first came out, I don't know if you're aware, but there's different grades of digital X-ray machines, and the their advertising for digital X-ray was that it produced less radiation, but it wasn't less radiation per dose, like per X-ray exposure. It was less radiation because it required less retakes of X-rays.
Okay.
Yeah. So in a day when
So it's
it's
clever
possible to take.
marketing. You know
Yeah,
what? I
very
actually thought
clever.
that the X-ray technology had changed. So I just learned something, which, by the way, I do every single time we do a podcast. So now, when someone gets a film, they may or may not have a radiologist read it. So first and foremost, there's plenty of doctors. They shoot a film. Hey, I don't see a fracture. We're okay, or a major dislocation. But there's a whole lot more to that story, isn't there?
There is, there is. I mean, I truly believe that, but there's not always something there. But I think it's just like what I believe. Everyone with spine pain or almost any kind of not super serious health condition, someone should check. They should all check in with a chiropractor at some point in time, at least, right? And I think we have a more careful way to do things. We have a more holistic and conservative way to do things. Why you know jump a few steps and have surgery or something when you don't really need it. So it's the same thing with radiology. Why not send everything to the radiologist. And I'll say I'm a little biased to the chiropractic radiologist because I think we do best with spine imaging. And just to make sure, I think it gives the patient extra sense of comfort knowing that a expert, that's all we do, it has looked at it, and then give a little bit more confidence to the chiropractor and say, okay, no, we had a guy that does this all day. He's been doing it for 20 years, and he says everything's okay, and no contraindications to getting adjustment or something like that.
Sure. Now, if there is a chiropractor watching, there'll probably be a whole bunch of them. I recall way back when the number one thing that chiropractors would get sued for, supposedly, was inappropriately touching a patient. One, don't ever do that, right? But
Mm,
number two was missing something on a film.
yeah.
So, it was very, very simple. Early on, all my films read by radiologists, and guess what? They can pick up something. You can pick up something that the average person can't even come close. Might think you're looking at alignment, biomechanics, and you are, but you're also very well versed in all of the pathology. So maybe share some of the more unusual things pathology wise, and then maybe even artifact wise that you've seen on films.
Oh, that's funny you mentioned the artifacts because we see a lot of them. Part of my training, I mentioned it a little bit earlier. So, our radiology training is 3 years after chiropractic school. And then I was really interested in other imaging like MRIs and CT scans. And we did get a little bit of that in our radiology residency within the chiropractic school, but I wanted more. And at the time, the only way you could do it was you had to volunteer as they call this a fellow. And I found our local teaching hospital would take me in. And oddly, they just as a side note, they did not recognize my training as a chiropractic radiologist. They didn't recognize DC, or actually, no, wait a minute. No, they didn't even recognize the Doctor of Chiropractic degree, Bob. Yeah, so
Wow.
my ID just said Cliff Tao, clinical observer, but my duties were, in the musculoskeletal and spine radiology department. And so I saw a lot of crazy types of pathology, but really good quality imaging because they had, the Ferraris of X-ray machines and CTs and MRIs. And then, but now, I pretty much only read for chiropractors. We have a two or three, medical physicians that we read imaging for. But the X-ray machines that are available to chiropractors aren't quite the same as the ones that are in hospitals. So, and not only do we usually not have radiologic technologists taking it, it's the chiropractor themselves are taking it. And so all of this in combination, it produces a lot of artifacts on the film. So, for your audience, if they're not familiar with what artifacts are, things that aren't supposed to be on the film, like sometimes we'll have people who have different types of hair extensions or hair that's really oily, for example, and you'll see the hair looks almost white on an X-ray, where before you wouldn't really see it, right? Maybe if you look really closely, you'll see it. And sometimes we'll see. Well, I don't know if they're really appropriate to say, but I'll just call them artifacts in the pelvis,
Oh
and
boy.
yeah.
Boy.
Better ones would be, or more appropriate to say, we'll see piercings in various places where we've seen them before, but the chiropractor wasn't expecting it, and then the patient forgot that it would show up in the X-ray, and they get a little bit embarrassed. We haven't seen one. Maybe I've seen one, not too many, where the patient. Oh no, I do. I remember one where the patient did not know she was pregnant, Bob.
Oh boy.
She
And
was,
you got the film.
and
Someone
we
didn't have
shot
to
the
go and
film.
didn't do pregnancy test, shot the film. Okay. Wow.
Yeah, because she said, she's, quote unquote, there's no way I'm pregnant.
Mhm.
And but she was bigger and she'd been gaining weight, but in her mind, there was no way she was pregnant. But they shot the X-rays, and I looked at them like, no, that's that's a baby inside there. We probably shouldn't have taken the X-ray, but we didn't know. So yeah, that wasn't a great one, but a little bit crazy to see. But yeah, we all sorts of weird things we see on X-ray pretty commonly.
Well, the artifact for people that didn't get your lingo, I'm imagining that if someone had something up their backside, they must have had a trauma and didn't plan on getting a film because I gotta know that that would show up. How horrible, but okay.
Yeah.
So now, is there a baseline study series that you recommend for maybe just your average person? And at what age should we start looking at radiology?
Oh, so for X-ray and CT scans, there's ionizing radiation. So, uh, but the amount of ionizing radiation, we learned in school, right, Bob? You and I learned in chiropractic school that radiation is bad, and X-rays have radiation, and so there's been this whole thinking that X-rays are bad for you, but the amount, if you look at the details, the amount of radiation for a regular X-ray study is so small, and there have not been any known harmful effects from a basic X-ray. There have been for other types of imaging, like a CT scan, PET scan. So those are bigger ticket items. There's a lot more radiation going on, but for plain X-ray, there isn't. But just to be on the safe side, we say you probably shouldn't have a screening X-ray unless there's some type of indication. So for example, just as a quick example, if you're older, say 65 and older, and you have a history of smoking, there's a couple things, you want to get screened for. One is lung cancer, and they have these CT scans that are low dose, and even Medicare will pay for it, if you want to go that route. And the other thing is abdominal aortic aneurysms. So you're at risk if you've smoked. I think, according to the literature, if you've smoked more than 100 cigarettes, you're at significantly increased risk, especially if you're a male and above the age of 65. So if you fit those parameters, or your patients fit those parameters, they should get a screening X-ray, or better if it's a screening ultrasound, to look for the abdominal aortic aneurysms.
So, question about that, right? If it's calcified, obviously it'll show on film, but do you have to shoot a special film? Would a lumbar X-ray show a non-calcified abdominal aortic aneurysm?
Oh, really good question. No, it would not, to answer your question. But most aneurysms are calcified.
Yeah.
There are some that aren't. I think they're pretty rare. But yeah, completely invisible on the X-ray. And so that's why I say it's better to get an ultrasound to screen for the aneurysms if you fit those parameters. One, it's more accurate, and two, there's not even any ionizing radiation associated with ultrasounds.
Do you also read ultrasound?
I don't personally, but we have guys on our team that read them.
Good. I want to
Um,
mention about the chest film, and that's a very good screening. I can't tell you, I've had multiple cases over my 30 plus years. Someone comes in, smoker, chronic cough. I ask them, when was your last chest film? And I hate to say it, that a couple of those came back positive, and those patients aren't
oh,
with us anymore. So that screening caught early, if you get lung cancer early, you got a shot. If you get it late, your chances of surviving go down exponentially. So
yeah. Oh, one more, breast cancer. I think everyone knows, but if you're a woman and I think they keep lowering the age. Last I heard, it was at 40 now. And, I mean, you should be doing self breast exams, but getting a mammogram too can be very helpful.
So my audience would be more biased towards thermogram, just
Oh,
because of what we've
thermography.
known
Yeah.
about radiation, right? So compare those two, breast thermography versus mammogram. You feel, is thermography a good screening, safe screening, or what do we do with that?
I actually don't have much experience with thermography. We don't read them, but I do know, we have a few centers around us that do them. From what I heard, I think you just have to find a good one, like anything else. Because I've heard there's some thermography centers that don't quite keep their machines calibrated, and the results can be off. But there's good ones out there. So you just have to find a reputable one. And I think I feel like they're probably more sensitive to different things, different cancers and stuff like that. And I think once, hopefully, they never find anything, but I think once you do find something, you do have to eventually get a mammogram, if you're going to go that route, right? Most of the medical guys, they want to, they have a protocol for once there's a detected cancer.
And what
Uh,
about MRI? Do you like MRI for breast?
oh, I do, but I don't think it's a good screening tool.
I would agree.
So one more thing about thermography. I think it detects most types of breast cancers, but not all of them. And I want to even say I have a friend we trained together, at the teaching hospital. She's a medical radiologist, and she's a breast or radiologist. She reads is mammos, MRIs, and stuff like that included. And she herself had breast cancer. And she says, she told me that thermography does detect most breast cancer. She's the one that told me that it doesn't detect a couple of the more common types of breast cancers. So I would
Well,
get probably
common,
both.
if they're common, we certainly don't want to miss it, right? So
Yeah.
if that's a deficit in that screening tool, then everybody needs to be aware of that.
Yeah. So that's my only reservation with that. I just, find a good place and then be aware that it could be missing, one of the more common breast cancers.
Quick sponsor break. This podcast is brought to you by bettercoffeeshop.com, the world's best organic coffee, 3 years running, infused with reishi organic mushroom, by the way, top superfood on the planet. An extra special day for me, my book, a 40-year project, Magnificent by Design, just released. And I do say 40 years. Yeah, I started writing a book 40 years ago, put it down, picked it up, put it down, picked it up. I've got it now. Magnificent by Design. So, Doc, when I was in school, they said, the probability of you seeing a primary bone cancer in your entire career is almost zero. Has that changed? Are we seeing more primary malignancies, or still is it 99.999% metastasis when it's bone?
Oh, yeah. I mean, I wouldn't say it's zero, but it's pretty darn small. I'd say
So that's
maybe
still accurate.
1%. But yeah, most of the ones we see, although sometimes we never hear confirmation, but I'd say most of the time it's like you said, metastatic or secondary bone cancer.
Yeah, your world, you find it, right? And then it's up to the other docs to say, where did this start and what do we do about it?
Yeah.
But finding it is critical. So let's tell some of those stories. Did you ever see a little maybe early indicator that you said, it's probably nothing, but let's go with caution, and it turned out to be something? How often do you see that in your practice?
Oh, on a weekly basis, I'd say.
Oh, that often.
Yeah, and,
Very little.
yeah. I mean, to be honest, I probably don't know the exact number because I don't read all the films in our practice. I probably only read maybe 10% of them. Uh, but anyway, but when I was reading everything, that it was probably on a weekly basis. Sometimes it wouldn't turn out to be anything. It would just be like a normal variant, or it was just some weird artifact maybe. But yeah, it's not that uncommon, because a lot of the images we get from other doctors, these are ones where they already suspect something, or those are the only ones they send us. We don't sometimes we do have doctors that send us everything, but we also have doctors that just send us the suspicious ones, so we
Well,
get a higher percentage. What's
the
that?
reason I asked about the subtlety is because that happens all the time. In retrospect, people go back and, hey, it was there. How did you miss it? Well, if someone like you're probably missing it. It's not zero, but it's close. Someone
Yeah.
who's not highly trained in radiology, good luck with that.
Yeah. And sometimes I remember this one where it was a lumbar film, A to P lumbar, where you could see into the pelvis and hips. And I thought one of the hips looked pretty suspicious. And it was a film taken at a medical center for a chiropractic patient. And so the patient brought in the film to the chiropractor. He looked at them. He said, "It looks, maybe their clinical presentation was a little off," and then that's how we got the films. And I said, "Well," and he told me that they said it was normal or just arthritis, but I thought there was something wrong with the hip. And so I told him what I thought. And I think, if it was me or, my mom or my son, I'll get another x-ray or an MRI if you can, or CT scan. And so he sent the x-rays back with the patient to the medical center with his concerns, which were my concerns. And they looked at it again and they said, "No, we think it's normal." And then he came back to me. I'm like, "Nah, I don't think it's normal. I would press a little harder." And he did, and it turned out it was metastasis. Yeah. So even, you know, you do your own homework, and we say, you got to advocate for your own health. Even even then, you might have to push a little harder than what you initially think you need to do. So uh, doesn't say, it's not very good for our healthcare system, but that's what we have to deal with. But I don't think you're a stranger to that idea, but I think you really need to look after yourselves and your loved ones.
Yeah, too much of this system is cost cutting, and that means not the right study, not the right team looking at it, et cetera. But if there's one thing worth investing in, it's absolutely your health.
Yeah,
So,
I
in
agree.
one of our exchanges, you wrote something to the tune that, if I'm remembering correctly, making your X-rays work for you. So, you recall writing that, and what did you mean by that?
Oh, yeah. So it's, well, I think we all do it, or not all. But speaking about chiropractors, but in medicine, it's very clinical, right? They don't even look at the X-rays. It actually, funny story. So I have neck pain and have arm pain, going down one arm more than the other. And I went to my medical doctor because I wanted to get an MRI. We had an X-ray done already, and he had the results. And when I went back in, he's like, "Oh, you don't need an MRI. Your X-ray results said you just had uh, mild arthritis." And he knows what I do, and he's very respectful. And I was like, I'm like, "Did you look at the X-ray?" And he's like, "No," which is fine. I'm like, "Well, FYI, if I looked at the X-ray, you know, I would routinely call that severe. They called it mild." And I don't just willy nilly call it severe because I know my symptoms. I have measurement parameters that I use. If it's half of the disc height or less, then I call it severe. And he's like, "Oh, really?" He's like, "Okay, I'll order the MRI then." But before, he was just relying off the paper report without looking at the images. And it's just like you said, they don't have time. It's not that they don't know how to do it. They don't have time to look at the images because they're under this time crunch to see a patient every 5 minutes or something like that.
Well,
So,
and the value, by the way, I always tell people, listen, sometimes there's things that encroach on in the spinal canal, the nerve root, and if they're soft like disc, hey, often we can solve that. But if it's hard like a bone, tougher
mm,
circumstance, right?
yeah.
So I don't want to get too personal in your. So what was the follow up? Was it an MRI? Was it a CT? And why did they choose what they chose?
Oh, so I did get an MRI scan, and I think they do that because, and I think it's common in the spine care community. Typically, you want to see the MRI over a CT because the MRI will show, like you said, the soft stuff a little bit better. So any kind of disc bulge or disc herniation, you can see better. If there's, I don't know if you remember, but behind the spinal canal, there's ligamentum flavum, facet joint capsules. You can see fluid a lot better on MRI versus CT. And another additional benefit of MRI is that there's no ionizing radiation, so we don't have to worry about that aspect of it. A CT scan will have ionizing radiation,
And very significant, correct?
quite a lot more than a regular, plain film X-ray.
Doc, I'm amazed. My typical podcast time is 30 minutes, and that's the magic time for my audience. So we're already, believe it or not, coming up on that. So
Oh, sorry
let's
about that.
find a few major things. Well, I've enjoyed the conversation. I think people are going to be enlightened. How can they find you first and foremost? What's the best way for them to see what you're posting? And what if they wanted to send you some film?
Oh, uh, well, there's not. They just have to know my name, and I think my name is somewhere around here. But there's not
Cliff
many Cliff Towers around,
A
right? So I
Tao
think
of who is, a Tao of everything. Yeah, classic name. Love it.
yeah. So if they just Google me, I'm on Facebook, LinkedIn. I'm still trying to figure out Instagram. But if you message me on any of those platforms, I monitor them all myself. I'll reply directly. But if you have imaging that you think you need a second opinion on, I would go through your chiropractor and have your chiropractor contact me, especially if you're a patient. Remember I said it's really hard for me to talk to patients, and it would be hard for you to talk to me too. So it's much better if you go through your chiropractor.
Hey, by the way, I don't mind being an intermediary. If you're not having an easy time getting your films read, and I said films, it's actually all digital images now, right? Listen,
Yeah.
you can look to me. I'll get it to Dr. Cliff. If you're dealing with something that you don't feel like is resolving like it should, you need an expert opinion. You deserve an expert opinion. And so many things I love about you. One, you have a natural background, you have a structural background, you understand biomechanics, you have a wealth of experience with films. And I got to tell you, every radiologist I've met, I can think of a few that were good with people. You seem to be above and beyond with that, but they are just egghead geniuses. You put a film in front of them, and they see more in milliseconds than an amateur could see in hours. Very,
Mhm.
very, very impressive skill set. Bill, what anything
Thank
else you want to say to the world before we sign off?
Uh no, just what we talked about, be an advocate for yourself, for your own health and your family and your loved ones too. That's the best thing we can do for ourselves. It's worth it.
It is worth it. Thank you for all that you do to make our wonderful world better. Your niche is a very special niche. Do you know how many DAC bars there are in the world? Not many.
Not many. I'd
Not
say
enough.
probably 400 then in all of the history of mankind. Yeah, so we all have a number, Bob. I'm number 279. That was about
Okay.
25 years ago. And we do about maybe 5 new ones every year. So we're
It's
probably
an elite club.
maybe in the 400s now. Yeah.
Was Terry Yoakum number one?
He was one of the not he wasn't number one, but he was up there or down there, I guess, however you want to look at it.
Most of us chiropractors know the name Terry Yoakum. He wrote the radiology manual that we read, and I believe they also used it in medical schools.
Yeah,
So
yeah, they do. They do. Yeah, that's a great book. I have it. It's right there. I don't know if you can see it. It's the little pink book.
I can't catch it from here, but it's on my shelf as well. And I got to tell you, radiology, I loved it, and I knew enough about it to know that send it to the pros, because there are subtle things, and like you already put out, your team is seeing subtle things weekly that a typical doctor might miss, and when you catch it early, it may very well be life-saving. And those are wonderful words to end on. And I'll end with this. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. Thank you, Dr. Cliff. Beautiful conversation. You make our wonderful world better, and I trust you'll keep doing it.